So now comment on studies about salt in your diet and how it may cause MS or make things worse. So this is work that came out of our laboratories, Dr. Vijay Kutru, who's a big scientist in our area, and they found that there's a certain gene that's related to Th17 cells. So translated, there's something that can make these cells that can cause MS. And salt, high salt, can make you have more of these bad cells. And if you take an animal model of MS and you put the animals on a high salt diet, they tend to get more MS. Now, we don't think salt is good in general, and it may be some of the autoimmune diseases that we have relate to our diet and may relate to high salt diets. Now, that it's very hard to cut down on your salt, but it's probably not good to have a lot of salt in your diet. And we're now, when I say we, the community is studying this. This is something that was just published a couple months ago. There's work done in Yale and humans on it. So this gets to the area of diet. When we get up to our next group up there, we'll ask some questions about diet. So that's the news about the salt. Continuing, there's some questions that I'll give to Dr. Leslie Weiner about stem cells. There's a few questions. What about stem cells in MS and repair? What's the stem cell update?
If you look at, we heard Dr. Bruce Trapp from the Cleveland Clinic give his data on gray matter disease, in which he shows an enormous numbers of stem cells in the MS brain. The problem with those stem cells in the brain is that they are not doing anything. They're just there. But there's tons of them, and they're there even in people who have died at age 77 who've had MS. So it doesn't seem to be anything that disappears, but it's ineffectual. The current state of stem cells relating to people, and there are about 40 or 50 trials going on. They're not really trials. They're basically some center that will give you your own cells and so forth. And those cells are immunosuppressive when you get them. They're no better than the drugs we use, and they cost about $40,000 or $50,000 to get this procedure. There's not a single shred of evidence that any of the stem cells that you hear about, or you go to Mexico for, or Costa Rica or whatever, when you inject those intravenously, that there's no evidence that they get into the brain. So if you're going to use stem cells, they're already there. You just need to seem to activate it. And that's really where the attention is going right now. This anti-lingo, for one thing, but there are many other situations where we're trying to activate the stem cells that are in the MS brain. They surround the lesion. They're very healthy looking in the pathologic studies, but we really don't see them doing the job of remyelination and protecting the axons. The bone marrow transplants are pretty much the same way. The patients get a lot of immunosuppression. We know that immunosuppression is good for MS. We also are beginning to hear, and we know that immunosuppression could be dangerous. So the issues of stem cells are really related to the fact that most of us are focusing on activating the stem cells that are there, because they're there. The question of transplanting into the nervous system is a big problem, because the lesions, as you know, are all over the place. So the question is, where do you transplant? The idea of using your fat for stem cells or your blood for stem cells, those are all good. They're effective in the sense that they're immunosuppressive. But so is, in a much more moderate way, the interferons, Copaxone, all the other drugs that you've been hearing about. They're just as effective as that transplant immunosuppression, and probably a lot safer. But the issue also is that we think that this is a wide open field, but we need to have things happening in the nervous system. So just giving an intravenous injection of a fat stem cell or a stem cell that's come from your skin or whatever is not going to do the job unless you get it into the nervous system. But this is an active area of research. It has not been quite what we hoped it to be. We've been working on activating the endogenous stem cells in our laboratory, and we think that there are going to be drugs developed that will work directly on those stem cells. They have to get into the nervous system to do that.
Okay, thank you very much. We'll keep moving along and move to the doctors behind us. So we'll keep going. This is a question, Dr. Bakshi. What is more damaging for the future progression of MS? Exacerbations that show in the form of physical disability, or scars that appear on the MRI without a relapse?
Well, it's a hard question to answer. I think both are important. I think we want to avoid patients getting worsening of their day-to-day functioning. Of course, that's what we all want to prevent in MS. We want to prevent relapses that debilitate patients for weeks at a time. We, of course, want to prevent accumulation of disability where a patient can't walk as well as they used to and that function doesn't come back. But the MRI lets us get ahead of the disease. So with the MRI, we can see changes going on the patient may not be aware of. The doctor can't detect them by examining the patient. For example, the appearance of black holes, the worsening of the total bright lesions on the scan, and also the atrophy or shrinkage of the brain or the spinal cord. That can be going on years ahead of the patient getting symptoms or getting their disease worsening. So ideally, we like to target all of those things together, and that's why when we test new MS therapies in clinical trials in large studies, we not only examine the patients for relapses, but we also do frequent MRIs in most studies to make sure that the therapy is having a very broad effect on limiting the patient's worsening.
It says there's been a lot of attention on no gluten diets, so we're interested in your comments on that. There's a question about vitamin supplements and should we be taking, there's swank diets, etc. Then there's a question, why are there so many miraculous stories about reversing MS through diets? Is that real? I've noticed a lot more drink vendors say that this might help. There's a question about a certain type of mushrooms, myco formulas, and gluten-free, this comes up again, and a plant-based diet. So
I think I'll start with the gluten, the role of gluten in MS. So far the research which has been done looking at effect of gluten and MS, it's not really convincing that there is a truly effect of gluten on kind of adverse effect of gluten on MS. There are people who will be gluten sensitive, which is just like general population, and they will probably do poorly like just because they are gluten sensitive. So in any patient who's not really doing as well and has a lot of symptoms which are unexplained, it's not unreasonable to check for gluten sensitivity, especially if it's related to a certain type of diet, like especially a wheat-based diet. So it's not unreasonable to get checked for that. There are blood tests which can be done to look for gluten sensitivity. The most specific thing for celiac disease is actually endoscopic-based biopsy of the gut, which can be done by gastroenterology. So there are a variety of ways to look for it, and if still you do not really have a good answer, it's okay to try a gluten elimination diet for a few months or so. It usually takes at least, I would say, 6 months or so to start feeling any difference if somebody's truly gluten sensitive. Some people start to see the difference right away. Like right away meaning like, within a few weeks of eliminating gluten. So it's very patient dependent. But overall, I think not every MS patient will be gluten sensitive, and not every MS patient should be eliminating gluten from the diet, because wheat is so widely used across the world as a staple diet. I'm not sure gluten or mineral, unless you have deficiency of that particular vitamin or mineral, there's no need to take supplements.